Hi, I'm Dr. Colin Lee. I'm an Associate Medical Officer of Health at the Simcoe Muskoka District Health Unit. Firstly, I would like to thank all of you for the care that you provide to the residents and patients whom you see daily in the long-term care homes, retirement homes, group homes, and hospitals, especially during the current COVID-19 pandemic. Your important work is deeply appreciated. As you know, we're currently in the midst of the annual respiratory season. And this year is proving to be very challenging with influenza, COVID-19, and RSV circulating at the same time. Thankfully, 2 of these viruses have safe and effective vaccines that will decrease your risk of being infected, which can in turn decrease your risk of passing these infections to the vulnerable residents and patients you care for, and of course also to your family and friends. Although the influenza and COVID-19 vaccines are not 100% effective, if you are immunized and unfortunate enough to still get infected, the vaccine will decrease your risk substantially from falling severely ill, developing complications such as pneumonia, being hospitalized, and potentially succumbing to the infections. In general, if it has been 6 months since you received your last dose of COVID vaccine or tested positive for COVID, it is time to get a booster dose, as the protection from the infection or previous dose will have decreased significantly by 6 months. For this challenging respiratory season, we're recommending healthcare providers get boosted earlier at 3 months so that they have peak protection during the respiratory virus season. So if you haven't received a dose this fall, please consider doing so. There is still quite a bit of COVID activity out there, as well as influenza. The COVID-19 community risk level, which is updated weekly on the Health Unit website, has been hovering at the moderate and high levels, and there are continuing to be COVID-19 outbreaks in long-term care homes, rest and retirement homes, and hospitals. Now, I want to talk a bit about influenza. Annual influenza shots are always very important, particularly this season as it is circulating more than usual. This year's annual vaccine also seems to be a good match to the influenza that is circulating in our communities. Both the COVID-19 and influenza vaccines are easily accessible at your local pharmacies. As well, there are some immunization clinics out in our communities, as well as healthcare providers that will have those vaccines. You can be immunized with both at the same time, with 1 shot in each arm. It takes about 2 weeks for the vaccines to reach peak protection, and so it is important to get immunized as soon as you're able to. Now, some of you may have specific questions with respect to the suitability of the COVID vaccine for your personal circumstances. The Scarborough Hospital has a free virtual clinic available to anyone in Ontario that you can book without a referral, where you can then speak to an experienced physician about your situation. The link will appear at the end of the video. You can also connect with our Health Connection line during regular business hours. Once again, thank you for all your tireless work with your residents and patients that you see daily. If you have not received your annual influenza vaccine or a COVID-19 booster recently, please do so to protect yourself, your family, your friends, your residents, and patients.